Today I'm talking to Professor Dr. Leonid Eidelman. Professor Eidelman is university professor in Tel Aviv for anesthesiology and intensive care. And he has been our president of the World Medical Association. He's indeed our immediate past president. He is also immediate past president of the Israeli Medical Association. So he has a pretty good insight into the healthcare system and the emergency situation in his country in Israel, but also globally. Dr. Eidelman, what is the general situation now under the COVID-19 pandemic in Israel?
In Israel, our situation is that we have about 1,000 total cases. And as in most parts of the world, I would say, we are on this exponential curve, on the sharp part of this curve. We had during the last 3 days about 200, and the last day it may be 100 new cases. And we have one patient that died. And if we calculate it, total cases per 1 million of population, we have more than 100. So we are not the leaders, but we have quite a lot of new cases. Maybe partly at least this increase of new cases is related to the wider testing that we have during the last week. We still don't have enough testing, to my mind.
With the increase of cases, you also will see an increase probably of serious cases, which means cases that need hospitalization. And among those, certainly a number will require also ventilation and intensive care. Do you see your healthcare system fit and capable of dealing with a high number of cases? What are the conditions for that?
It depends on the scale, definitely. We are a rather small country. We have about 9 million population, but we have the opportunity to ventilate some 1,000 patients, but not more than that. So it depends. To this stage, we have about 20 patients only in severe condition. So some hundreds, even maybe some thousands, it's not a big problem for our country. We have enough ventilators. If we calculate also the anesthetic machines, we have modern anesthetic machines that actually are ICU ventilators and can provide advanced ventilator support.
Are you preparing to shift capacities from elective surgery, elective treatments towards COVID preparedness?
We definitely are ready. And in some hospitals, people start working by shifts. It's 12 hours and then 12 hours and then the rest of 24 hours. But in most hospitals, we still work as usually. And we perform oncological surgery, trauma surgery, and we are not performing in our public hospitals elective cases.
Okay. We have heard at the World Medical Association that in many countries there's a shortage, especially of personal protective equipment, masks, gowns, gloves even. Is that something you have experienced in Israel as well?
Absolutely. We have a problem with personal protective equipment and shortage of surgical masks is not so acute, but shortage of N95 masks and even more advanced equipment is a real problem.
Now, I have seen that you have in national discussions been a little bit critical about the use of curfews and extreme restrictions to the populations. What is your view on that? I mean, we all agree probably that distancing is important, but how far should we go?
Distancing is very important, and from the early stage, we know that about 2 meters of distancing is good enough. And definitely people should stay more at home. But my personal view is that Israel started from the very draconic isolation method from the very beginning, from the, let's say, we stopped all the flights from China very early. It was at the end of January, and we stopped most of the flights from Europe at the beginning of March. So still we have quite a lot of cases, as I said, 100 cases per 1 million is quite a lot. Definitely not like in Italy, but it's still, I believe, it's quite a lot. So I personally believe that South Korean model is very efficient. It's to check all the population, nearly all the population, and to keep very much isolated those who are infected with COVID. So our method was different, and it's definitely influenced also our economic situation. And nowadays, our country looks very gloom, as you see on the streets. And we have, by the way, as the limitation of gathering was very, very early, not more than 100 people to gather to meet together. But then it was decreased to 10 persons, and that was the last recommendations. It's even more than the recommendation. And still, as I said, we have quite a lot of cases, and I believe that we have even more, because till now we performed only about 2,000 tests a day, which is a very low number to my mind. So definitely we have thousands of people infected in our community. So my personal approach that I was tried to promote all the time is wider testing and severe isolation of those who are positive, and development of infrastructure for intensive care, and protection of those who are above 65 years old. Which is also not so easy, you know. Probably. I'm afraid now that those who are 80 years old, 90 years old, staying at home, it will cause deconditioning, and they will become actually nursing situation very quickly. So all this, along with personal hygiene, I believe that now the situation in Israel is better. And I believe that it should be, or these steps should be taken much earlier than it happened in Israel.
What about shops and businesses? Have they been closed in part? Restaurants, have they been closed, for instance? And are people asked to work at home, or have even companies stopped working?
Very early, people were asked to work at home. Unfortunately, what wasn't done, it was a closure, quarantine of the areas where a lot of people were infected. So it's also my criticism about the government's policy. But restaurants, most of restaurants are closed. Some of restaurants are working on takeaway basis. And most of businesses are closed. Some of them work at home, but those who couldn't are closed. And we have a lot of people who were put on vacation without payment, actually on the way to be fired. So it's a big problem. I'm thinking about the future of our economics, and particularly what I'm very much afraid that in Israel, where health expenditure for the last 10 years was decreasing all the time. And actually, before this crisis, we had about 7.5% of GDP, about $2,300-$2,400 PPP per person in Israel, which is rather low for modern medicine. I am very much afraid that the economic crisis, as you said, always the solution, the wrong solution of the government will be to save money on health expenditures. So probably the worst is ahead.
We see these restrictions now, these constraints on the economy now in many countries. Have there been already exit strategies being discussed in Israel, how to get out of this restrained measures now in order to get the economy going again? I mean, at one point we have to change again, but what can we do in order not to endanger us to get a rebound from the infection, from the pandemic?
Yeah, it's. I believe that it's one of the most important questions, because for the last months, I'm trying to promote on our media the idea that the plan should be now how to put the economy on the right track. Unfortunately, it wasn't done, and only 2 days ago, the first time that our government started talking about planning, future planning, because no one knows at what stage can we go back from all these constraints. And definitely, as I said, the number will still increase. So the only maybe difference in Israel from other countries is that in 2.5 weeks from now, we have our Passover holidays. So at this time, usually people work less, and usually we have part of economy calm down. So this period will definitely last until the end of this holidays. So for 3, maybe even 4 and 5 weeks from now, we will have economy on a very low level.
For now, thank you very much, Professor Eidelman. Have a good day.
Thank you very much. It was my pleasure speaking with you. Thank you very much. Have a good day.
Thank you.